Hi, my name is Dan Frith. I'm a lawyer in Roanoke, Virginia, with the law firm of Frith and Ellerman. And our firm specializes and focuses a lot of its time in the area of medical malpractice, representing patients in claims against their healthcare providers. And as a result of that experience that we have collectively, we run across a lot of the same questions from our clients and prospective clients. And I want to answer one with you today that we get a lot. And that's the question of who are and what are the differences between medical doctors, DOs or doctors of osteopathy, nurse practitioners, and physician assistants. And their education, training, experience, and what they're permitted to do by law and by regulation in Virginia is very different. A medical doctor is what we traditionally think of when we use the term doctor. Those individuals have gone through 4 years of college, followed by 4 years in medical school, followed by at least a year to 4-year residency in which they focus on a certain aspect of the practice of medicine. They have to do all of that before they can enter into private practice as a full-fledged medical doctor. Well, what's an osteopath? Well, they call themselves doctors too, but they're not a medical doctor. They're a doctor of osteopathic medicine. And about 11% of all doctors in the U.S. are DOs. They are trained, or the doctor of osteopath are trained to look beyond your symptoms to help them understand and diagnose how your lifestyle and environmental issues might impact your health. Like a medical doctor, they graduate from 4 years of college, followed by 4 years at an osteopathic medical school, and then they go into an internship and residency, which helps them focus and specialize in certain aspects of osteopathic medicine. Both MDs, medical doctors, and DOs, doctors of osteopathy, are licensed by the state in which they practice. And they can both specialize in any of numerous different specialties, from family medicine, surgery, cardiology, pulmonology, gastroenterology. It's unlimited. Now, let's talk about NPs, nurse practitioners. Most nurse practitioners complete a master's or doctoral program and have advanced clinical training beyond being a registered nurse. They can order diagnostic tests like x-rays and lab work. They can diagnose and treat acute and chronic conditions like diabetes, high blood pressure, infections, and they can prescribe medication. Nurse practitioners, though, are not medical doctors, nor are they osteopathic doctors. They are one of the team of healthcare providers that we see in today's healthcare world. PAs, physician assistants. Typically, they complete 4 years of college and then somewhere between 2 or 2.5, maybe 3 years of additional education. It's a master's level degree, which focuses on the medical sciences. They also do not go to medical school. They do not go to osteopathic school. Physician assistants can take medical histories, conduct physical exams, diagnose and treat illnesses, order and interpret tests, prescribe medication, and in other areas assist physicians in the provision of health care. Neither a nurse practitioner nor physician assistants are medical doctors or osteopaths, and neither is ranked higher than the other. They perform different functions. So that's a brief summary of the difference between a medical doctor, a doctor of osteopathy, a nurse practitioner, and a physician's assistant.